Pateru Mounika, working as behavioral therapist for autistic children. So today I'm going to talk about what is autism and what is behavioral therapy and the most effective therapies for the autistic children. So now, autism is developmental disorder where the child has issues while communicating, such as with speech correction, speech usage in relevant situations, and the children with autism have difficulty in socialization, such as they feel uncomfortable being in a group. Uh, they play like they have difficulty playing cooperatively with other children. With they won't be able to understand social cues, and also they have difficulty understanding other people's emotions. And along with socialization, they have issues like restricted interest, like sticking to the daily routine. Like if they find even the small change in daily routine also, uh, it creates a big disturbance for them. They may react extremely, like showing extreme anger, extreme crying, excessive crying, or which they exhibit some emotions extremely, like aggressive behaviors, anything. And also unable to and also having obsession or interest to specific objects, such as like uh, obsession to anything. It can be keys, it can be any dolls, specific dolls, or anything. Obsession. If you ask them or if you force them force them to take that object also, they won't allow it. They don't like it. It creates a great disturbance to them, and they react in extreme manner, in anger or excessive crying. And also they show repetitive behaviors, such as repeatedly lining up the toys, repeatedly doing the same task, like doing repeatedly the same thing again and again. Like for example, uh, there was a kid who used to play with glasses. Okay, he used to pour water from one glass to another, one glass to from another glass to he used to pour water from one glass to another repeatedly, continuously. Like that, they have. It is not restricted to one task, only to one task. They can do with any task, like doing repeatedly the same task, and they try to indulge in that only. They engage themselves, instead of playing in a appropriate way, like appropriate socialization, they do something which is like very inappropriate, like repeatedly doing some behaviors, inappropriately playing, or sticking to the one specific task, and throughout the day they will be doing that thing only. Okay. And also doing repeatedly hand movements, like hand flapping, and rocking, and also specifically no name response and no eye contact. Like if you call them, they don't respond. And also while talking or while interacting with them, while doing any task, no, they won't give any eye contact. Without giving eye contact, they just ignore, or they just follow what you say. Some people don't even respond whatever you are saying. They just do it what they want. That's all. And along with above autistic features, the child has any sensory issues. Either it is like overstimulation or understimulation of sound, vision, touch, smell, etc. The sensory issues, such as like no autistic kid uh, will be like same. He won't be like same with other autistic kid. They are very different. When you compare one autistic with the other autistic, you won't find any similarities. But we can only jot down in one categories. Like he will be having issues in socialization. He may be having issues in speech. He may be having issues in behavioral issues, like repetitive behaviors, no response, no eye contact. But when it comes to like in autism, they specifically, it is like they won't show similar kind of behaviors when compared to the other autistic children. They show different kinds, but they come into one category. They come into one category. It's like when we say like sensory issues, like overstimulation or understimulation of sound, vision, touch, smell, etc. It is like some autistic child, they don't like sounds. Okay, specific sounds which are like beyond the threshold level. They hear the normal threshold level of sound also as a high level. They won't be able to bear. Okay, it is like overstimulation. Even they have like some kids has overstimulation of touch, understimulation of pain sensitivity, vision, and also in vision also they like to take more stimulation. Like some kids like to watch lights, constantly staring at them, gazing, like they will be gazing that light thing, or like the light thing, or spinning. Like if there is any object which is spinning, they will stare at that. Either they will spin the objects and they will take stimulation to this visual vision. These are like sensory issues in autism. Not only the socialization, speech, repetitive behaviors, but also the child may have like sensory issues also, and also along with this, the autistic child may have other comorbidity like disorders like ID or any other disorders also in comorbidity. They may have like co-occurring another disorder, other mental disorders also. And now I have like listed out DSM-5 criteria of ASD, like what it's like persistent deficiency in social communication and social interaction across multiple contexts like that, and deficiency in social emotional reciprocity, for example, abnormal social approach, failure of normal back and forth conversations, to reduce the sharing of interest, emotions, or affect, to failure to initiate or respond to social interactions. Okay, like and also deficiency in non-verbal communicative behaviors also, like pointing and communicating non-verbally, like social interactions, poorly integrated verbal and non-verbal communications, abnormalities in eye contact and body language, or deficiency in understanding and use of gestures, total lack of facial expressions, like they won't be able to understand what other person's emotions, or what they are. They won't be able to understand how they are feeling by seeing their expressions. And some of the kids, they don't even know like how to express themselves in relevant manner. And also it's like deficits in developing, maintaining, and understanding relationships, as they have lots of issues in socialization. They have deficits in developing good or maintaining good relationships with others, and they have difficulties in adjusting behavior to it suits with social context, and difficulties in sharing like imaginative play or in making friends. As I said, like socialization, they don't know how to have like how to play with others, and they don't have pretend play, proper pretend play. They don't know how to engage themselves appropriately. And uh, and when it comes to the stereotyped or repetitive motor movements, use of objects or speech, like simple motor stereotype, they have like some mannerisms, they do it repeatedly, okay? Like lining up the toys, flipping objects, or repetition of speech, echololia. Like whatever you speak, they just repeat what you say. Like not only speech, they even imitate actions exactly how you say, with actions, expressions, they just imitate whatever you say, without uh, talking or without doing it relevantly. And also they always stick to routine, they don't like to change it. Okay, if there is any slight change also, they get very disturbed. They show like some show extreme behaviors. They show extreme distress at small changes, difficulties with transition. They have rigid thinking patterns, and they need to take some route or eat food every day. Even they don't like changing routes also. Like if they are coming from home to the therapy center, if they are using one route, they have every day they have to use the same route to come into therapy center. If they change the route also, they won't accept. They show like they get irritated, and highly restricted fixated interest, that are abnormal intensity or focus. Like as I mentioned about the sensory issues, hyper or hyperactivity to sensory like input or unusual interest in sensory aspects of the environment, like apparent indifference to pain, temperature, adverse response to specific sounds or textures, like excessive smelling or touching the objects, visual fascination with lights or movement. And also, most of the symptoms must be present in early developmental period, but not may not become fully manifest until social demands exceed limited capacities, or may be masked by learning strategies in later life. Symptoms cause clinically significant impairment in social, occupational, or other important areas of current functioning. As I said about along with autism, they may also have like comorbidity of other disorders like ID or global developmental delay. Like all the children with autism who have these issues, they have delays in they have all delays like cognitive, social, emotional, physical. It depends. It varies with the child and child. Some have like full physical development, but they don't have delays in physical, but they have delays in cognitive, social, or social delays or emotional delays. Some have so emotional delays, some has physical delays. It depends. It varies with everyone. It is unique to everyone. They show different. They show different features. And the next one is the child may have delays in developmental milestones such as issues with speech correction, understanding and usage in relevant context, physical developmental delay, cognitive delay, or emotional delay, or combination of all. Okay. And the most widely used therapies are like most widely, and I also say that effective therapies can be occupational therapy, speech therapy, behavioral therapy, and special education. And now, when it comes to the occupational therapy, it fully deals with ADL activities. ADL activities are such as like brushing, bathing, as they have delays in physical development. Physical delays, they have lots of physical delays. So they will first train them in fine motor, gross motor skills. They will improve them in that, and after that, they teach ADL skills like brushing, bathing, dressing, like self the skills which are important for the like daily routine, and also with sensory issues. Like what are the sensory issues, which is like making them like not to give attention or making them very frustrated with the sensory issues. So they will work on sensory issues, sensory stimuli. They will control their sensory stimuli. They work on their sensory issues and they control that, and then they will work all these things like physical developmental things. And next one is speech therapy. Speech therapy, as you know, it mostly deals with the speech correction, understanding or usage of speech in relevant context, and jargon speech or repetition of speech, especially like echololia. Like whatever you speak, they just repeat without giving relevant response what you are asking to it. And next one is behavioral therapy, which deals with the repetitive behaviors like socially which deals with like repetitive behavior, socially inappropriate behaviors, and aggressive behaviors like hitting others or biting themselves, self-injurious behaviors like that. And and also PT work, the other therapy works on socialization also, socialization and cognitive aspects like thinking, reasoning, attention, and also working on mental age, like age appropriate cognitive level to improve their cognitive level. And when it comes to special educator, he deals with academics, as not all the kids will be diagnosed with intellectual disability or with other learning disorders. So special educator deals with the academics. When a kid comes with the basic, I'm going to tell you a basic model, like not basic models, a basic intake. How we need to start? Okay, so first basic intake, I will say the basic intake for behavioral therapy can be like behavioral therapy or for therapy module, model or module. First, we need to assess the child whether he has other disorders along with autism or not. Just mention only autism or autism with other disorders. Two categories. Okay. When it comes to two categories, one is autism. Yeah. And the another one, if it's autism other disorder, it can be ID or the other mental disorders. So first we will jot down into two categories. So before assessing it, so name, age, disorder, other disorders, what are the developmental delays he has, like in physical what developmental delay he has and in which developmental delay he is, in which age, physical developmental age he is. And the next one is cognitive, like what are the delays he is having, like right now it at what level of cognitive he is, and according as mental age is different and his actual is age is different, will be different, so you have to correlate both. Maybe he will be 4 years but his mental age will be 2. Yeah, right. So we have to jot down like that, and we have to see which age, which mental age. So what delays he has? Cognitive, in social delays, emotional delays, speech delays, and next one sensory issues. Especially when it comes to sensory issues, what are the things? Touch, smell, vision, sound. So just jot down like especially what he has. It's not like he will have all kinds of sensory issues. He will have specific kind, specific sticking to one. Either he will have vision, touch, smell, vision, touch, sound, or combination of all. And next one is basic commands, like whether he is able to follow basic simple instructions or not. And just write it down. What are the skills he also has already? Like when it comes to skills, there are more like some, most of the autistic kids have hyperlexia, like they can read, write, not like they have the ability of academics above their age, above their age. Like if they are 2 years, they can read all the letters, they can combine all the letters, spellings, and they can speak that also. They can spell that word also. They have this ability, like they will know all the colors, all the shapes, all the birds. I had a student who had like he knows like every bird, every bird he knows it. He just by he has, most of the kids have visual memory. And next, that is hyperlexia, who has the ability of above the age appropriately. Now, pointing, like whether he has pointing skills or not, and whether he is able to recognize relations or not, like whether he is able to identify himself, identify father, mother, and other family members, and what is the processing of information, like whether he is able to understand the information, like verbal instructions especially. After writing it down, all these things, the first thing is behavioral therapy. So that is first intake, and after noting down all these questions, plan will be formed. Like firstly, therapists need to assess all the developmental milestones screening of the child, and should make a plan based on autistic features to be focused on and the delays. The most common techniques used are positive reinforcement to improve skills and reduce other problematic behaviors to improve the quality of life of the autistic child. The important aspects for a child to focus are command following, attention, observation, imitation, application or usage, and thinking. Skills to be focused, socialization, reducing the intensity of fear or discomfort while being in a group by repeatedly exposing to different groups, and appropriate doll play, like recognizing people, like recognizing social group. And next one is turn taking, whether the child is able to understand the concept of turn taking or not, because it is very essential for the basic socialization and imitation of actions, like whatever you do, like whether he is able to copy that or not, because it is very important, as we need to teach them first. They need to copy the skills, then only we can make them learn. Yeah. And next one is sharing things. It is like in socialization, these are like levels. Okay, first one is like reducing intensity of fire, like fear or discomfort. Like first the child need to be like comfortable being in group, then only we can make the child learn the skills, social skills. Directly making them into the field will create anxiety to the child. And next one is play concepts, like understanding social cues. And when it comes to the like cognitive, identification of colors, shapes and other category objects. To improve cognitive skills, like puzzles, logic games, matching are very important. And also there are like perceptual skills are very important, as it gives clarity how the child is perceiving the information and processing. And categorizing all the categories, it can be animals, fruits, gender, situations, whatever it is. Categorizing all the situations, all the categories will help us to improve more or work on this more important aspects, other areas of child. And understanding of daily routine activities, like having understanding, like more from morning to evening, what is he doing. It is not like just being in the moment, or just being in that moment and forgetting everything. Making the child understand the concept of daily routines, being in that daily routine and making him understand, and that is very important. Then only he can associate thinking and reason. So these are the categories. uh, as you understood, like what all comes under. So under like behavioral therapy, socialization, cognitive skills, behavioral issues like aggressive behavior, socially inappropriate behaviors will come. But when it comes to the occupational therapy, it is different. They deal with odd aerial activities, sensory issues. Speech therapy will fully focus like on speech and usage of speech, speech production, misarticulation, all these things. And this is just an outline about what therapy, like which therapy works on what. Thank you.